2 lines.
Knowing that there's likely to be perhaps reduced funding in this area from some of our partners because of where we are and maybe some of the things that are happening globally, I think then that special attention of further mobilization of domestic resources for funding becomes extremely critical. I'm sure some of you may have been watching closely the recent summit of the heads of state in Paris. Very powerful statements came from the heads of state who did speak there. The President of Kenya, I think is it Nguesso, and even Ramaphosa. They made some very, very fundamental statements that require special attention globally, and we ourselves have to know what we can do. And I can flag out specifically when Ramaphosa was talking about how African countries or the least developed countries were struggling to get the COVID vaccinations. You know, he was almost in tears from what I could see. So clearly the message that comes out there is that tears may not move those partners out there. So we might as well roll up our sleeves and see what we can do, because if you think we are going to get some shoulders to cry on, I think it is evident that that is not going to happen very soon. It is up to us to mobilize and raise those resources out here. Several efforts have been put in place to ensure that no one is left behind, including provision of insurance subsidies for the elderly, orphans, poor, and vulnerable, for the pregnant women and children, and high school students in public schools. Treatment of children under the age of 5, that of prisoners and street children, is free in public hospitals. Health services at primary level facilities are also offered free of charge, while management of key conditions of concern such as HIV, TB, and malaria are equally free of charge in all public health facilities. With this increase in coverage of services, issues of financial sustainability, efficiency, and quality of care must be addressed.